Returning to our special reporting series, Arizona Addicted, that explores the opioid epidemic. This week, we look at one effective measure taken by the state to combat the crisis that allows the public to get in touch with a professional, no appointment needed, just a simple phone call. Judy Alley has more.
But we also want to make sure that she's, back to her baseline mental status, not tachycardic.
The morning shift has just started at the Arizona Poison and Drug Information Center in Tucson. So far, it's received calls about pets being poisoned.
Right now, it sounds like all your dogs are doing really well.
And a few from folks with basic medical questions.
Essentially what that means is that it kind of thins out the blood.
But with almost 4,000 suspected opioid-related deaths reported in the state since June of 2017, medical professionals here know it's only a matter of time before the narcotic calls start to come in.
Arizona Opioid is a referral line.
We're in the middle of a full-blown opioid epidemic and help is needed.
Since March of 2018, the Arizona Poison and Drug Information Center in Tucson and the Banner Poison Drug and Information Center in Phoenix have been operating the Arizona Opioid Assistance and Referral Line. It's the first of its kind in the nation and was established as a result of Governor Doug Ducey's Opioid Epidemic Act.
This is such a vital service because not only are we helping prescribers help stem the tide and reverse the course of opioid overprescribing and opioid deaths, but we're also helping patients get the services that they need and get connected to the resources that they need.
Managing Director Stephen Dudley says this free 24-hour service is manned by specially certified pharmacists, nurses, physicians, and toxicologists. He says it's designed to help people with any questions related to opioids.
Okay, and it's her prescribed medication?
Andy says it's also intended to help health professionals navigate new opioid prescribing laws.
There was a lot of information to drop at one time that went into effect really quickly. And so with that came a lot of confusion of, well, am I doing this right? I don't want to get in trouble. I don't want to break the law.
Follow-up is a major part of the service, especially with patients.
We'll have a chart started. We'll give a call back and check in with the nurse in a couple hours.
It's for their comfort, make sure that somebody out there cares. They may be alone, they may be scared, may not have anybody that can stay with them.
We're just trying to meet what people's needs are for the follow-ups. We never want to chase you down, but we want to make sure that you're comfortable moving forward so that you're not spending money and utilizing a resource that you don't need to, but also that if something bad's happening, that you're not thinking, oh, I'm sure this is just fine.
Health officials at both the Tucson and Phoenix office say the line has helped thousands since its launch and also saved many lives.
Okay. And how much does your little one weigh?
But as the service continues to grow, they say they'd like to see more efforts to promote it, especially with emergency departments.
They're kind of in a treat 'em and street 'em type of mode to be able to see the patients and get them out, and sometimes that connection isn't made.
The line is currently promoted at medical facilities through community outreach programs and by the media. In addition to broader efforts to get the word out, Dudley says he would like to see the telephone-based service expand its technical capabilities.
We're in 2020. We have the internet. We have, telecommunication, video conferencing capabilities to be able to reach to the rural areas of Arizona who don't have clinics, who don't have resources, be able to offer a face-to-face consultation to help give that expert information to help the patients out there.
And as more folks get dialed into the services the phone line has to offer, Dudley hopes the opioid crisis will dial down and eventually become an epidemic we can hang up.
The number to the Opioid Assistance and Referral Line is 888-688-4222. You can also visit oarline.com for more information.